SARA stands for Support and Resources to Assist Hesitant Parents with Vaccination. So it's focused on the fence sitters, the parents who are really hesitant. But it also is actually a package for primary care providers primarily, because we knew that they're influential. We knew that parents, when they talk about changing their mind about vaccinating and deciding to vaccinate, will often say that it was a healthcare provider who convinced them to do so. And we know that those conversations can be really challenging for both parents and providers, and we like to support a process that makes them more satisfying and that retains the kind of trust that means that if parents don't vaccinate, they are willing to come back to the practice if there's an issue. So SARA, because it's focused on hesitancy, we're building a set of resources to support those conversations. So we've been talking to doctors and nurses a lot. We've been talking to parents in focus groups. The unique thing about SARA is that it's tailoring and targeting strategic approaches in primary care around vaccine conversations. So if you think about clinical pathways, where you do a diagnosis, you put someone in along a pathway and treat them accordingly. These are communication pathways. So the different categories of parent that we've simplified are the parents who are fully accepting of vaccination. They may have a few questions, but they're ready to go ahead. Then there are the parents who are really hesitant. And then there are parents who are declining. They're not going to vaccinate at all. And these are actually quite different groups, where it's appropriate to have different goals and different strategies. So if you think about the hesitant parents, the typical concerns they have are around the number of vaccines given, that they're given to such young babies, the ingredients in vaccines, and specific concerns about particular vaccines and particular alleged side effects, like the autism issue. What we're trying to do there is to debunk some of those myths using science, using communication science. So the resources that we've developed for providers to share with parents, once they've identified that they have that concern, are following the rules around debunking. You don't rehearse the myth up front. You state the thing you want people to remember. And then you explain where the myth came from and fill the gap. If it's not true, for example, that vaccines cause autism, which they don't, what does cause autism? What does science know about that right now? So you fill that gap. You tell parents who wrote this resource and what their qualifications are. You provide other links and references so they can see that your claims are based in science and not just something that came up that you decided they needed to know. And then the important thing about SARA is that the resources like this that we're developing, we're testing as we go, and we're changing things as we hear back from parents and providers. So it's an iterative process that enables the final package to be as effective, as useful, and as sustainable as possible.